presentation from Dr. Gruman, I think we're looking at the subject quite seriously as ourselves. In that sense, we're also talking about public policy issues. We'll be talking about public policy issues as well with Michelle Moroney and the food safety issue, which I edited that book, and it's a bit of a horrifying topic. I mention all this because Dr. Gruman will tell you about, at an early age, how she dealt with disease and has gone on a path that clearly is the path that was chosen for her in her life. And I'll also tell you why this is subjective, because the subject is ourselves, because probably of all the dear friends we have here tonight, no one needs to pay more attention than I myself in terms of patient responsibility. I will be honest with you, many of you know this, I push myself far too hard in my work, and it hurts my health, my family, and ultimately my job. So in terms of responsibility, that is part of the equation of the risk, trust, choice, responsibility paradigm. And I will tell you that there is no more articulate, passionate, and eloquent spokesman than tonight's speaker. Please welcome Dr. Jessie Gruman.
Last May, I was honored to receive an honorary doctorate from Salve, Regina University without spending 4 years of hard work. And today, I'm delighted to return to have a chance to experience Salve, Regina in its working mode instead of its partying mode. And I can tell you, if Salve Regina academically operates anywhere near the level it operates when it's celebrating, I will learn a lot before I leave. That was quite the celebration at graduation last year, and I see some people who I met here then. It's nice to see you again. I'm honored to be speaking in the Pell Center. Senator Pell's extraordinary effort to democratize higher education made it possible for me and millions of other kids to learn and to study and to contribute. I'm grateful for his commitment. So, tell me, how many of you have ever cared for a loved one who was really ill? How about who have yourself been very ill, received a really bad diagnosis at some point? How many of you are health professionals, nurses, doctors, who have an investment in taking care of you who are ill? This is good. There's almost nobody here who's not at least as expert as I am, which means that I'll talk for a while and then we can talk together and it will be interesting. So let me just tell you this little story about myself. When I was 20 years old, I was diagnosed with a very advanced case of cancer. And I spent my first few days after hearing the news being just incredibly shocked by this news. I was just starting. How could this happen to me? How could it be that I might die? I was just bored. So when I was well enough to go home from the hospital, I began the daily trek for weeks of radiation, for months of chemotherapy. I was skinny, and I was hairless, and I was non-compliant. Each time my doctor administered my chemotherapy, he would say, well, take 6 pills daily, and you can kind of take them at this interval, you take 2 for breakfast, and 1 after lunch, and then those of you who've been ill know about this story. Well, so, I might take 2 pills, but then maybe 6, oh, so the next day I wouldn't take any, and then I'd take all of them, and like that. So my doctor would tell me that it was important to stay home because my immune system was at low ebb and I was at grave risk for infection. I would go out dancing. Oh, there it is. So a few years later, I looked back in awe. Millions of dollars worth of biomedical research that was distilled into the knowledge and experience and procedures and drugs that were aimed at treating a disease that was costing hundreds of thousands of dollars to treat. And the success of this entire enterprise rested almost entirely on a skinny, scared adolescent to have its impact. I had to show up. I had to cooperate. I had to take those drugs like I was supposed to. My critical role in achieving the benefit of the best available treatment has been brought home to me again and again through 2 additional diagnoses of cancer, through the treatment of a dangerous heart condition, and then the ongoing maintenance of someone who's had that many diagnoses and that much treatment. And I've been so very impressed over time with the tools that are now available to treat diseases that even 20 years ago would have been a death sentence. And I'm so very, very grateful for that. But one thing about these advances that's widely overlooked is the extent to which their success increasingly requires our active and knowledgeable involvement. We have to know when to seek help. We have to choose the right doctor. We have to trust his or her advice and act on it. We have to get the test, we have to take the pills. We have to choose to avoid the risks. We have to do all of these things or we won't now realize the benefit of health care. So it's puzzling that the national debate on healthcare reform consistently focuses on 2 factors: the cost of healthcare and access to it. These 2 concerns and the focus on them obscures an equally important but virtually unexamined 3rd factor: the growing number of responsibilities that we, you, me, my mom, your kids, our friends, sick or well, have to perform competently if we're going to have any chance of getting better. The traditional passive sick role that's familiar to all of us here, particularly those of us who are 30 and above, it doesn't work anymore with today's health care. But our new roles and our new responsibilities are often unstable. And they're frequently unrealistic. They leave us we're left kind of to discover on our own what they are. And if we don't perform them competently, we undermine our health and erode the effectiveness of our care. So I propose that the convergence on one hand of the tremendous advances in medicine and on the other, public and private policies that reflect our uniquely American understanding of personal responsibility pose particularly daunting challenges to us as patients. So I'm going to describe some of these challenges through the lens of 3 universal judgments that all of us make again and again when we seek health care. We have to assess the risks to our survival and our health. We have to decide who we trust to help us reduce those risks. And among those we trust, we have to choose who or what to enlist to end our pain and to save our lives. Now, underlying each one of these judgments are questions about responsibility. What's my responsibility relative to the doctors? What's my responsibility relative to the government? Relative to my health plan? Relative to a pharmaceutical plan? In the broader sense, how do institutions, rules, regulations, and individuals interact so that we can be as healthy as we can be? So consider this, for example. We're grateful for advances in surgery and drugs that allow us to return home from the hospital quicker, but we tend to be sicker when we get there. So we become our own caregivers. We find ourselves managing complicated drug and dietary and wound healing therapies on our own, things that otherwise would be done by professionals in the hospital. This is such a great example of how advances in technology give us so much, but require so much of us. Again, new treatments, new medical specialties and subspecialties of doctors mean that we often have many more choices of treatments and doctors. But to make really wise decisions when we get a bad diagnosis, we have to learn about our disease, we have to figure out the treatment options, we have to find a doctor, we have to sort through each of the trade-offs that we have to go through in order to actually find good care for ourselves is really a lot of information and quite intimidating. And similarly, new drugs mean that those of us who have chronic conditions like cancer and diabetes can live long and well, even though we have these diseases. But doing so means that we have to manage complicated and often disruptive drug-taking regimens, change our lifestyle, coordinate care across a bunch of different doctors, and then manage the insurance and the billing. Many of you know what this is like. It's a big deal. Indeed, if we are going to realize the benefits of modern healthcare, each of us is going to eventually have to do all of these things, regardless of how ill we feel or how frightened we are. Without our active and informed involvement, all that beautiful science, all those marvelous drugs and devices, all that specialized training, all those experienced professionals will fall short of their potential, and we will suffer. So let's consider the judgments we make about risk first. You know, all beings are hell-bent on survival. As humans, we're hardwired to make constant calculations to avoid threats and to choose the less dangerous options. Sometimes we do this instinctively, like swerving off the road to avoid the deer, right? But more often we kind of unconsciously construct rules about risks, what might hurt us, what might help us, wearing garlic to ward off diseases. Sometimes we base these rules on our experience, sometimes on scientific information, sometimes on what our mom said, sometimes on what we saw on TV. But most of the time it's kind of like this soup of things that we put together. And then that's how we come to believe what's risky and what's safe, right? The rules that we create powerfully influence how we use healthcare. Here are two people describing their approaches to risk in healthcare. First guy says, I generally give a symptom about 3 days to go away on its own, and if it still bothers me, I go see my doctor. This is the fear of anybody who has anything to do with healthcare costs, is that everybody's going to go to the doctor after 3 days of symptoms, right? Another person. My doctor said that there was a 50-50 chance that my tiny little early-stage breast cancer would grow. Now, I'm a glass half full kind of person, and so I thought I would be one of the lucky ones. So I tried non-medical approaches, I did meditation, I diet, but my cancer grew, and I had to have a mastectomy. And can you see how these statements include a little science, a little experience, and a lot of personal preference? Here's the thing. If we're going to benefit from the best available health care, scientific evidence about risk has to be the dominant guide of our behavior. There is data about risk, there are data about risk available, and there's more of it all the time. The government warns us not only about toxic substances, role of the government with regard to health risks. How free are we to be foolish? In New York State, the governor a couple weeks ago proposed a ban on sugared drinks to prevent obesity. And he was met with howls of derision and refusal on the part of both the citizenry and the beverage business, imagine. Should there be a law requiring our kid to wear a helmet when he goes skateboarding? Should the Federal Food and Drug Administration be funded fully so that it can competently regulate the safety and effectiveness of drugs? Should we be allowed to take prescription drugs that might hurt us? We're faced with a steady stream of new information about a bewildering array of risks, and we long for legal and regulatory measures that would provide us with simple information about what's safe and what we need to do to protect ourselves. But, for example, when we're desperate to use an unapproved drug that we think might, for example, but I want to, let me just go back here. But, I'm having a little PowerPoint trouble here. We're faced with a steady stream of information, but we don't really have that information at our fingertips. For example, when we're desperate to use an unapproved drug that we think might save our life, generally as a nation, we prefer the government to inform us about risks and then to let us decide ourselves whether to avoid them. So it's no wonder that we feel overwhelmed. The same scientific processes that have the potential to extend our lives have increased the volume of risks that we have to consider knowledgeably if we and our families are going to be as healthy as we can